Hello, everybody. Welcome to the release of the second annual Frontline report. Thank you for taking the time out of your Friday to join us. I'm Brandy Ernst. I'm the Chief Impact Officer here at Gaudenzia. I have a few housekeeping items. One is all guests except for the panelists will be muted until we open for questions. And then we'll open for questions from the media attending after the panel portion. So today we will have a panel discussion with leaders from the areas that we serve at Gaudenzia. And I want to introduce you to the leader of our discussion today. Dr. Klatzker is the President and CEO of Gaudenzia and has recently been appointed by the Governor Wolf to the Pennsylvania Behavioral Health Commission for Adult Mental Health. I'm proud to introduce to you Dr. Dale Klatzker.
Thank you and good morning, everyone. I am the President and CEO, as Brandy just said, of one of the largest substance use disorder treatment providers in the Mid-Atlantic and actually in the country. And we're really pleased that you're here joining us for our second annual report. Our report is a county by county review of the substance use disorder trends in the areas that Gaudenzia serves. We last year served well in excess of 13,000 people. And this is a report of what we learned from some of the data we were able to gather in the 12 months that ended in June. This report is a key part of our mission to inform government leaders, to inform law enforcement authorities, social service agencies, media, and the general public about what we are seeing on the front lines of the fight against substance use disorder. As we know, this continues to plague our cities, our states, our neighborhoods, our homes. As part of this year's release, we're fortunate to have a very distinguished panel of leaders from Pennsylvania, Delaware, Maryland, and from the District of Columbia. And they will be joining me today for what we believe will be a nice conversation. So first I want to welcome, I will introduce them a little bit later, but I want to welcome Lieutenant Governor of Delaware, Bethany Long. I want to welcome Secretary Jen Smith of the Pennsylvania Department of Drug and Alcohol Programs. Want to welcome Dr. Moise, from Deputy Director of the Department of Behavioral Health in Washington, D.C., and the Honorable Robert Silkworth, who is the Senior Circuit Court Judge in Arundel County in Maryland. Thank you all for taking your time to join us today. Before I turn the program over, I just want to raise a couple of things. We wish that this could be a good news story. We would like nothing better than to produce a frontline report that showed a decrease in the need for services. Unfortunately, it's simply not the case. Nationally, we know that over 107,000 people died in the US last year from drug overdoses. That's a 15% increase nationally from the year before. More locally, in the 50+ Gaudenzia facilities located in some of the hardest hit communities that we serve, primarily substance use disorder diagnoses remained on pace with the previous year. Slight upticks in alcohol use, stimulant use, and the use of hallucinogens. One troubling statistic emerged from last year's data that suggests that a little bit more about the scope we're dealing with. At least 30% of our admissions had both a primary and a secondary diagnosis, a substance use disorder diagnosis. So what does that mean? Well, what it means is that we're seeing increasing amounts of people in our system with polysubstance abuse issues. It's not just one drug, it is multiple drugs. There's much reporting of stimulant use in this group. And frankly, I said it's 30% of our admissions. My guess is it's much, much greater than 30%. So what does that suggest? It suggests that our industry needs to develop new and specific withdrawal management, and clinical treatments for these substances, while also treating the social determinants of health and other factors that spur addiction. According to the National Survey of Drug Use and Health, over 41 million Americans who needed treatment for substance abuse disorder in 2020, only 6.5%, or just 2.7 million, received services. 2.7 out of 41 million. We wouldn't tolerate that in any other medical situation. This is a crisis that affects us all. The personal and societal costs are staggering. And with the illicit drug supply increasingly dominated by things like fentanyl and other drugs like xylazine, and stakes are getting just even higher. In just the last week alone, reports emerged of candy-colored fentanyl tablets. I don't know if people saw that, but this is terrifying, because one of the most potent drugs out there is now being marketed to the most vulnerable, like they're M&Ms. I can't begin to tell you how insidious this is. So what can we do beyond issuing reports like this? Well, for one thing, it's past our time to deal with the stigma that permeates both substance use disorders and mental health disorders. It's past time to recognize that the sufferings of our fellow citizens affect us all, and we need to partner across all systems, all agencies, all constituencies in order to create a solution. No one can do this alone. It's going to take all of us. We have to have the collective will. Providers, policymakers, the general public, media, to treat substance use disorder with the same creative, innovative, holistic, and financial approaches that we use to treat COVID-19 or cancer or health disease or any other number of health crises. Lucky for us, we have leaders such as the four people who are going to speak soon. Each is making a huge difference in this battle to decrease stigma, increase access to care, and to get people on the road to recovery. So what I'm going to do now is I'm going to introduce each panelist. After I introduce them one at a time, they will have about 5 minutes or so to give us a sense of what they see in their own state or geography, and what they believe will make a difference, how their state is approaching the crisis, and what their reactions were, if any, to the data that we promulgated. At the conclusion of the 4 brief presentations, I then have a couple of questions I'd like to ask each panelist to respond to, and then we will open it up for media questions. So let me introduce, first and foremost, Lieutenant Governor of the state of Delaware, Bethany Hall-Long. The Lieutenant Governor is absolutely and truly one of us. She earned her nursing degree at Thomas Jefferson University before earning her master's in nursing and community health nursing, and then a PhD in health policy and nursing administration. From 2002 to 2017, she served in the Delaware House and Senate before being sworn in as the state's 26th Lieutenant Governor in 2017. During her tenure, she has elevated substance use disorder and behavioral health to be a top priority. So, Lieutenant Governor, we're going to give you 5 minutes to the table. The floor is yours.
Thank you. Wow. Thank you, Dr. Klatzker, and to Brandy and to your incredible team. And Cheryl, I think it's phenomenal. As I look at my colleagues here in the surrounding contiguous states, we have to all lean in together. This is certainly a very much a bipartisan issue with nonpartisan solutions. And I am so delighted, as you indicated, I'm not going to repeat things that are in the report because I find conversation is the best way to master solutions. I will just say to you, I will probably say what my fellow 3 surrounding partners are going to mention. You were spot on. The data are there to show that certainly coming out of the pandemic, we've had the twindemic, and persons have certainly the data support that we continue to have an increase in co-occurring disorders. I'll start in reverse. I hadn't planned on talking about the children's issue, but you touched on it. Our major hospital system last week, we had 2 young adults, 14 and 17, who were taking what they thought were street level Adderall. It was laced with fentanyl. One pill can kill. These are the issues that are facing us each and every day. And I can tell you that in Delaware, we are, like each of the surrounding states, making sure with our opioid settlement funds that are coming in, making sure with our ARPA recovery that our office through the Behavioral Health Consortium, which I know my partners at Gaudenzia are aware of and my surrounding states, that Delaware had set a model up. As chairwoman of the National Lieutenant Governor Association, I know many folks have looked at our Behavioral Health Consortium, which has been established with stakeholders and partners, addressing cradle to grave, to which Gaudenzia, you are at every step of every opportunity, prenatal to adult services, et cetera. But it is a serious issue. It is truly the virulence, the case fatality that we are seeing of the level of fentanyl. And just like you stated, I follow closely the data we do. The data are telling us that in our state, persons who've been turning to polysubstances of meth, crack, and cocaine are now being laced even more with the deadly fentanyl. And that is a trend for which we had not necessarily seen. And so again, the fact that we have young children, persons who typically have been taking stimulants and others, that is a real concern. The optimism that I have is that I know that when we get together across jurisdictions from our work in drug diversion with law enforcement into making sure we have the additional parity that's necessary in insurance. And I know that's why Delaware and others, we've been working with insurance industry, had some fines with parity to make sure persons can get continuous wraparound service, intensive outpatient, and when necessary, residential. I could go on and talk for a very long time about the work that needs to be done. The one thing I can say, the lesson I learned by being boots on the ground, myself administering 4,000 vaccines of COVID as a nurse during this pandemic, what I have seen is when we provide those social determinants and the wraparound services early, and we have the insurance and the provisional coverage with good case management, we can do better. Delaware was one of 4 states in 2020 that saw a dip in the overdose death rate. Now, 21 has been a very different story with the use of the more deadly levels and types of fentanyl. We did see a dip. And why so? Because we were a game on, very intensive. And let's face it, we're a small state. I know compared to the geography of Pennsylvania and Maryland and Jersey and others surrounding in DC. But we were able to place persons and treatment and wraparound, giving them shelter. So social determinants are huge. So again, in keeping with my time that has been given to me, I very much support what you're doing. Thank you for the Frontline report. And I think having these conversations are important. Very honored to be here with the leads of persons who are very knowledgeable in behavioral health in Pennsylvania, DC, and Maryland. And you have my full commitment. I know our governor's commitment and the leaders in our Department of Substance Abuse and Mental Health, Joanne Champney and others, our cabinet secretary, we are full in. And so thank you for having Delaware here today. I look forward to conversations. Thank you so much.
Thank you so much. Our next panelist is Jennifer Smith. Jen has served as the Secretary of Drug and Alcohol Programs in Pennsylvania since 2018. Prior to that, she served as a Deputy Director and after a long and successful tenure in the Office of Budget. Pennsylvania has been blessed for the last 8 years with a governor who understands the scope of the substance use disorder crisis and has worked diligently to improve the lives of so many people. And Secretary Smith has played an absolutely key role in that throughout a wide range of initiatives, and worked well to pull people together. So, Secretary Smith.
Thank you, Dale. I appreciate that. And I'm going to break protocol here and do a screen sharing. I promise I'll stay within my allotted minutes here. Can everyone see my screen? Great. Yeah. So I honestly, I just have 3 slides to share, but I think that it really helps explain what's happening in Pennsylvania in terms of the landscape of the addiction crisis. So we were not as fortunate as the Lieutenant Governor in Delaware. In 2020, we did see an increase in overdose deaths. You can see in 2021, we reached 5,300, which was dangerously close to what had been the peak in 2017 of what was then called the opioid crisis. Now I think we've morphed to calling it the addiction crisis for all the reasons that Dale mentioned and were included in the FrontLine report. We see many of the same things in Pennsylvania that Dale had outlined in terms of polysubstance use. We'll come to that in just a second. The other trend that we've noticed and I thought was really worthy of mentioning today is a drastic increase in the overdose death rate of Black Pennsylvanians. So, when you break down the actual overdose death rate in Pennsylvania by race, you will find that for the white population and for all non-Black races, it has pretty much plateaued. It's been fairly consistent, if not slightly declining. But if you look at the darker purple line on the screen right now, which represents the Black population, you see that line continuing to climb and trend upward. So that's something that we're really keeping a close eye on in Pennsylvania, trying to figure out how we can get some funding opportunities to organizations that specifically target and engage individuals from those communities. I often get questions about why that population, what's happening. And I think some of the reason really is a result of the discussion that Dale had around polysubstance use. So I'm going to show this slide quickly. In Pennsylvania, 78% of all of our overdose deaths last year included fentanyl. And what's happening is fentanyl is not just being used in conjunction with heroin, as we kind of typically saw a few years ago. Now we're finding fentanyl in so many other substances. And you can see here on the screen in combination with benzos, with cocaine, with methamphetamine, with heroin. So within the Black communities in Pennsylvania, while heroin or opioids may not have been their primary drug of choice for many decades, things like cocaine and methamphetamine were more rampant in those communities. And now that we're finding fentanyl contained in those substances, we're starting to see a large number of deaths resulting because these communities aren't prepared for an opioid overdose. They're not maybe equipped with naloxone. They might not be using safely and ensuring that they're using near other individuals who are equipped with naloxone. So just wanted to kind of set the stage there. I'll stop sharing. The last bit I'll share, just so we can keep on track with our timeline this morning, Dale had asked if we'd share a little bit about our response to the FrontLine report. So I wanted to share a couple of things about what Pennsylvania is doing to address specifically the issues that were called out in that report. So one of them was around workforce. And we've done a couple of things to begin addressing workforce. And I say begin because this is going to be a long haul issue for all of us. One of the things we did was use some of our federal funding to put out some dollars to our providers in the form of stabilization payments. And they were able to then use those payments to do things like increase salaries, pay stipends and bonuses, offer sign-on bonuses and things like that. But the other really big news in PA was the awarding of over $20 million for a loan repayment program. And that was a really tremendously successful program. We were able to help about 300 clinicians and case managers all across the state pay off their student loan debt. And, you know, that has been really helpful for all of them in terms of making their jobs more palatable. And part of the requirement for that loan repayment program was that they continue to work in the field. So it was a good way of rewarding folks who are already in the field and also incentivizing them to stay so that they can see the full fruition of those loan repayments. They also mentioned stigma. We've done a lot of work in this space with our campaign called Life Unites Us. The first year alone, we reached 4 million Pennsylvanians with messages of hope and recovery and talking about opioid use disorder as a medical disease. We're now in year 2 of that project, and we've expanded it beyond opioids to really focus more on substance use disorder more broadly. So if you want to check out the website, again, it's Life Unites Us. Great campaign to address stigma. And my last point is funding for special populations. So in the FrontLine report, you read a lot about pregnant women and women with children. We've specifically offered some funding opportunities for that population of people, as well as some other special populations like veterans. And really have been putting a focus as well on recovery support services. So ensuring that folks who are able to successfully complete our treatment programs have that follow-on service to lean on and ensure that their recovery continues long-term, that it's sustainable. So that was just touching the surface, but I'm gonna yield the floor back to Dale so that we can keep moving with everyone else. Thanks so much.
Thank you so much, Secretary. I now would like to introduce Dr. Jean Moise. Dr. Moise is a licensed clinical psychologist with extensive management roles within various behavioral health managed care organizations, health plans, and community provider organizations. He is the Deputy Director of the DC Department of Behavioral Health. He has significant experience serving vulnerable and underserved populations, and he's recognized for successfully partnering with payers, consumers, and healthcare policymakers to address traditional barriers to healthcare access. Dr. Moise.
Thank you, Dale. Pleasure to be here. I really appreciate being invited to this very important discussion. In the limited time we have, I think all I can do until we move to the discussion conversational phase of this event is to give you an overview of the landscape in DC. Very consistently, it parallels, especially a picture that Secretary Smith and you have painted in Pennsylvania and some of the other large urban areas that in our country and some of the challenges that they're experiencing. So I very much want to paint a picture of what we're dealing with at a very high level, what we're doing, what our priorities and strategies are to combat this epidemic, this SUD epidemic, primarily driven right now in DC by the opioid epidemic, and then how I see us continuing to build on what we've already accomplished to make even further progress moving forward. First off, a brief statement about the Department of Behavioral Health. The Department of Behavioral Health is the state authority in the District of Columbia responsible for overseeing, managing, and ensuring quality for all behavioral health services in the district. Our focus is about prevention, intervention, education, and ensuring access and quality of services to our members. So in that spirit, I want to share that we have a real challenge in DC. We're not unique. Our opioid fatality rates are high, but they're below the national average. But we do have a crisis on our hands, as other states have, and as your data is evidenced. In 2021, the district unfortunately experienced 567 intoxication fatalities. 75% of those, about 427, were due to opioids, and 95% of those involved fentanyl. The trends have been concerning and very disturbing over the last several years. From 2019 to 2020, we saw in the district a 46% increase in opioid deaths. But from 20 to 21, although there was still an increase, there was improvement due to our harm reduction strategies and very aggressive efforts to curb the tide. So the increase in from 20 to 21 was only 4% over the year before, as opposed to 46% previously. In the first 5 months of 2022, we've actually seen a decline in the number of deaths in the district. Again, evidence that what we're doing is working. So we need to continue to do what we're doing, working with community-based organizations, stakeholders, providers, and the community in general to educate and raise awareness and to combat this disease. So for the first 5 months in 2022, we saw the number of deaths drop by 4% almost, from 172 in 2021 to 166 in 2022. Consistent with Pennsylvania's numbers, again, unfortunately, of those that are experiencing generally overdosing and who experience fatal overdoses, 84% in the district are African American, 75% are male, and 72% are between the ages of 40 and 69, consistent again with your numbers and what's happening around the country. Even more alarming is the fact that recently, partly due to the COVID epidemic, many of those deaths are occurring in isolation in people's homes and residences, which makes it harder to intervene, harder to engage those folks and redirect them to treatment if they're open to it. 82% of our fatalities last year occurred in personal homes or residences. It's all about harm reduction. We're doubling down on harm reduction, and some of the activities we're doing and priorities we're pursuing are naloxone distribution. We distributed 57,000 naloxone kits last year, and we're on track to deliver even more this year. We're expanding the range of access points where people can get naloxone, including community sites, pharmacies, hospitals. We're supporting syringe exchange programs. We've got a mobile van that's engaging the community, especially in hotspots, to do preventive education and engagement. We partnered with FEMS, Fire and EMS, to outreach to folks who have overdosed, but who were not so impaired or ill or medically compromised to go to a hospital, to follow up and ensure and educate them about care and resources available in the community to try to get them to follow up and obtain treatment. We're pursuing lots of low access services within the community to open up the access to treatment. We're offering ride on demand. We're offering recovery housing to over 200,000 folks suffering from substance use disorders. And we're increasing peer engagement at all our sites, community sites, health clinics, hospitals, and support within provider treatment facilities. Lastly, I want to mention that we are also very excited that by the end of the year, DC is launching a crisis stabilization and sobering center, a very low access, low barrier access point to try to get people who are really intoxicated and suffering, to give them a chance to clear their heads, engage with treatment providers, and know what their options are in terms of recovery and the help that's out there, and provide necessary support to get them to the next stage of recovery. So limited time, but that's what I wanted to share in terms of what's happening in DC and where we'll go. Thank you.
Appreciate it. Thank you so much. Last but certainly not least, I'd like to introduce the Honorable Ronald Silkworth. I'm sorry. Judge Silkworth is a senior judge in circuit courts in Arundel County. He has long been a champion of providing opportunities and rehabilitation for those with mental health and substance use disorder needs. He has helped sponsor an annual training day for other Maryland judges on SUD issues. And he was also instrumental in the state's very innovative, now over 20 years, program in terms of diversion opportunities into treatment for those individuals with who have come before the courts. So Judge Silkworth, got 5 minutes for you.
All right, thank you very much. First, let me, by way of disclosure, indicate that I am a 26-year experienced senior judge. I'm not speaking for the judiciary. I'm here to speak based upon my 26 years of experience. Of course, I'm also not advocating for any particular provider. Having said that, I've been doing this for a long time. I've been on the firing line as a circuit court judge. I have presided over hundreds of thousands of cases in which substance use disorders are involved. I took the bench in 1996, and it didn't take me long to conclude that, in my opinion, way back when, we were in a crisis. And I believe we have been in a crisis for decades. Obviously, it's been exacerbated by the COVID-19 issue, and of course the ever increasing flow of drugs and fentanyl across our borders. Having said that, I think it's important to note that it's generally recognized that about 85% of the work of the courts is impacted, not just the criminal dockets. 85% of the work of the courts is impacted by this population. And during the time that I've been there, and I recall back in 1996, when I began doing the criminal docket, I learned to my dismay that there were only 10 beds statewide in a program called Health General 8507. 10 beds statewide in Maryland. I had many more than 10 people that needed those beds. So way back when, we looked towards sending people out of state in residential treatment. As a result of a collaborative effort, as Dale talked about, as a result of a collaborative effort, that's now changed. Since I took the bench, we now have drug courts in likely most county, if not all counties in Maryland, in addition to which we have an improved and effective Health General 8507 process that would allow any judge to be able to, in essence, apply the principles that make drug courts successful. Here's the dilemma and the problem. Many good things have been done. Much more money is now put into the 8507 process for beds. But the problem is that we're not reaching, drug courts reach only 4% of the population in need. That's all. And the 8507 process, with all of the improvements, it does not reach the remaining part of that. So we have in Maryland, I think, a process that allows judges who are of a mind to use it. But unfortunately, the problem is exponentially growing. I mean, here's the issue with this population. They need, based upon my training in behavioral science, to be successful, they need continuous care, continuous supervision. If that is not provided, and then they're going to fail. Even if it is provided, the nature of the issue is such that there will be relapses. So even today, there are judges who do not accept the proposition that treatment works. Well, I can tell you, having done this for many years, that treatment does work. It works if it's worked. I've been motivated largely based upon, unfortunately, the loss. I'm one judge in one small county in one state, and I've had 100 death certificates cross my desk. 99% of them are related to drugs and overdose. So, that's why I've been so passionate about this. I believe, as Dale indicated, there must be a collective will. There are a lot of good people doing a lot of good things in all the agencies, on all the programs, and I've been fortunate to be able to participate in collaborative efforts over the years that took the 8507 process from 10 beds to what it is today and the funding that exists. But it just isn't enough. We have to improve and increase the collaboration. Continuity of care and continuity of supervision requires everybody to be involved and everybody to be on the same page. If there's a break in the supervision from parole and probation, for example, then there's going to be a problem. Unfortunately, we don't have the necessary, I think, treatment within the jails themselves, because I've had too many of my people become addicted while they were incarcerated. So what do we need? We need whatever is necessary to ensure the continuity of care and the continuity of supervision. We also need a stronger, I think, emphasis on prevention. We need leadership from all three branches of government, in my view, working together as they have done successfully in the past, to provide the necessary funding, provide the necessary education for judges in the behavioral science. We have advocated the creation of a behavioral science university. So every judge would have an opportunity to have extensive education in the area of the behavioral science that drives this population. And to eliminate what some judges think, or some think that the use of a treatment program is like a get out of jail free card. It's not. I viewed this over the years as my responsibility as a judge to follow the law requiring that we punish, deter, and rehabilitate. We need to continue to do that. We need to do a better job with that. I can tell you that it works if it is worked, and it's my pleasure to participate in this panel, and I hope to continue working to try to advocate for more education and increase in the number and the extent of drug courts. And importantly, the recommendation that was made by those who created the drug courts 30 some years ago, they recommended that the principles that make them successful be applied to the entire work of the courts. If we do that, then I think we can make a dent in the problem. Thank you.
Thank you so much. I'm going to change the order a little bit. We had a series of questions that we were going to, that we had prepared to ask people, but given the time, I'm going to reverse the order. We'll see what media questions we have. We'll open it up to that, and that will either take us through the end of the hour, or if there's some space there, then I have questions I can ask each of the panelists. So, do we have any questions from our friends in the media?
And feel free to take yourself off mute to ask your question, and we'll highlight you in the spotlight.
Okay, well, I'll ask some questions then. Lieutenant Governor, we know that substance use disorder is a social determinant of health, a public health emergency. Why do you think it isn't treated with the same urgency as other diseases?
Oh, wow. We could all sit here for the next hour, I think, and the panelists answer this and those listening in. I think all of us know that, unfortunately, the emotional well-being with individuals has had that awful, I hate to even use the word, but stigmatization around the level and appreciation of how the mind-body connection. And so I'm pleased, just like we heard in Washington, D.C., our neighbors in PA and in Maryland, you know, we've been leaning in and talking about how health, we all know coming through the pandemic and epidemic of opioids, that it affects our economy. And I think, as the judge just mentioned and talked about, we have to destigmatize and recognize this as an illness, and that individuals should have parity. And that's why working with groups like Gaudenzia and others, many of us in the legislative side and executive branch have had parity battles with insurers and others to make sure that we elevate and have appropriate reimbursement. I know in our state, we've worked really hard to make sure that legislators this year passed that when people go to get a health screening, they can also have a mental health screening. And so again, it's that barrier, I think, Dale, that has been a big issue. And so once we get everyone knowing it's okay not to be okay emotionally, and put in place all the things that we've been doing, whether it's stabilization centers, having the lock zone available, having things available with a hotline, the new 988, all of those things matter. And so again, I'll stop because I know you've got other questions for folks, but again, let's all do our job, which we do, and talk about emotional well-being, just like we would a chronic disease with cancer, diabetes, or other.
Great, thank you. Secretary Smith, you disappeared from my screen, but hopefully you're still.
I'm here.
Oh, okay. With the staggering number of overdose deaths nationwide, what do you think it's going to take? What can we do in the short term? What do you think it's going to take to reduce these numbers?
Yeah, that's a great question, Dale. I mean, I think others have alluded to it as well. There's sort of not one solution that's just going to magically fix things, but I think that a heavier focus in a couple particular areas is going to be really helpful. One, of course, is in the harm reduction space. And the federal government has done a great job of expanding allowable uses of funding. We're still struggling with that a little bit at the state level in Pennsylvania, allowing things like syringe services and fentanyl test strips. But harm reduction is a great space that's prime for expansion in most states. The other area that I think is really important we don't forget about is the recovery support space. So what we saw in Pennsylvania during the pandemic particularly was a large number of the overdose deaths were occurring in the recovering community. So people who had been in long-term recovery, but as a result of isolation, financial difficulties, not being able to do their recovery programs, we saw death in that group in large numbers. So ensuring that we're really beefing up the recovery supports that we're offering and supporting all the pathways through recovery, right? So not just focusing on certain types of supports, but really expanding access to all of those things. And then, of course, continuing to really focus on programs like warm handoffs, where we're using peer specialists to get folks engaged and connected to either treatment services, harm reduction services, or recovery supports. So in my opinion, those are kind of the areas that I think we need to really focus on to get the deaths down. And then once we get the deaths down, we can really focus on some other things like the quality of all of these services and sustainability of them in a more integrated way within the mental health and behavioral health more broadly and physical health space.
Great, thank you so much. Dr. Moise, this is a question that's near and dear to my heart because it is the obstacle that restricts our ability to have as much access to care as we would want, and that's the workforce issue. What do you think it's going to take to get people, attract people to work in this industry? There are many, many, many interesting programs, projects, interventions, harm reduction approaches, but there are nowhere near enough people desiring to do this work to be able to even operationalize these great ideas.
Sure, Dale, very important question. And as you said, a great impediment to us executing on many of the strategies and action steps that we anticipate or would like to do. I think the biggest issue, again, from a behavioral health authority or government, from the government side, is to pursue paths and strategies similar to what Secretary Smith just outlined. We're pursuing very similar strategies in the district. We have recently provided grants to ACT providers and school-based providers to shore up their operational systems and structures, and really almost free money to say our goal is to increase access, to bolster your systems, to recruit quality people to do the critical necessary work that needs to be done. So use these dollars, given the outcomes that we all have, the shared outcomes and expectations, creatively, any way you want, whether it's clinically, building clinical systems, processes, and infrastructure, hiring and addressing workforce issues, operational support that you may need given the impact of COVID. So I think it's listening to providers, hearing what their pressure points and what their challenges are. And as government and as a system, regulatory system overall, seeing how we can not only support providers, but encourage people to enter the field, as you said. A lot of people feel like, I think people that can make a difference, especially people with lived experience, that they won't get the support they need from government and insurers and payers if they enter the field. So I think we need to negate that message as well, and to say your work and your value and your potential contribution is important. And we are going to work together to make sure you can make a decent living, and you will be supported in order to be effective in that role once you step in, if you choose to step in. And that's what we're trying to do in DC.
Great, thank you so much. Judge Silkworth, what impact did COVID-19 have on law enforcement diversion programs, such as the 8507 program in Maryland? And, what can we do to reclaim some of what we've lost, maybe?
Well, I can tell you I got a phone call from Christy, Miss Blaylock, during the COVID crisis, and it scared us to death that the providers, without the providers with Gaudenzia and other providers, the problem just going to get worse and worse. So, of course, as I pointed out, I have felt that over the years that we've been in a crisis, and we have the resources, but fortunately, as a result of the efforts from Christy and Judge Littman, one of our judges, and other judges, the money that was needed to ensure that providers like Gaudenzia were able to survive, and many other providers, it came through. So you all are here alive and well. We're happy to have you. Absolutely necessary in order to deal with this longstanding crisis.
Great. Thank you so much. Lieutenant Governor, are you still with us here somewhere?
Yes, I
Okay,
am.
great.
I'm a little mobile, so I'm off. I am absolutely with you.
Okay, great. So our second question for you is, in your opinion, what's really working in the realm of public policy, and what isn't working?
What I have seen working is the fact that there is that recognition now, particularly after COVID, of the impact of social isolation and mental health, right? And so we have all been in the front lines in our area states doing the traditional naloxone upticks, making sure that we had attention paid to our the traditional methodologies of medicine. But what I have seen is the real interest in recognition of social determinants and the imperativeness of policymakers seeing the preventative levels of service, particularly with our youth, and then also with screening and treatment. So I see that level of policymaking being really important nationally. I know my colleagues across the country last week, many of us were together and trying to borrow those models. So as Gaudenzia today, you've pulled together panelists in law enforcement, substance use experts. Again, I think policymakers are hearing and seeing advocacy from our groups. Those of you who've been in the trenches for 2, 3, 4 decades, advocating for mental health. But now that this is impacting the workforce and others have experienced it, the social isolation, I'm amazed at how many legislators across this country and the House of Delegates, the state houses of reps and senates are literally, this is a top 3, 4, 5 policy item. So I'm encouraged. I also, like you, though, recognize we have a ton of work to do and that our numbers, unfortunately, are high, and we've got to walk the talk and make sure we are indeed putting the funds and the pressures to make sure insurance coverage is present.
Great, thank you so much. We do have a question from Dana Monroe of the Capital Gazette. Dana, if you unmute yourself, please ask your question.
My question is for the judge. I cover Anne Arundel County for the Capitol, and wondered, outside of the legal system, what kinds of interventions and programs from the county or state you found to be effective from your point of view?
Well, we're fortunate in Anne Arundel County to have, and have been for years, to have a very robust criminal justice coordinating council that includes all of the agencies of and the health department, mental health agency, the police department. And they've been active for many years, in addition in creating diversion programs and creating peer-to-peer programs through our local detention center, and creating local-based workforce development. Those programs, anything that will help someone who is getting out of jail, transition into the community and deal with the problems that very often led them to commit the crimes and continue to use the drugs, they're super. So there are, Anne Arundel has a lot of programs that I think are very effective. And I suspect, I'm sure that other counties have similar efforts underway.
Great, thank you. Secretary Smith, you know this is an issue near and dear to Gaudenzia's heart. What more do you think we can do to help pregnant and parenting women and other vulnerable groups?
Yeah, I do know it's near and dear to you, Dale. So one thing I'll say, in Pennsylvania, the legislature created a task force recently. It's called the Child Opioid Abuse Task Force. Not a real big fan of the name there, but a fan of the intention. And that group I am a member of, and it pulls together state agencies that have oversight of child welfare issues, my agency, the Department of Health, and then a number of different stakeholders, advocates, parents and grandparents of children who've been impacted by the opioid crisis. And the goal of that task force is to really assess how we can do a better job to support these children. And in those conversations, it naturally leads to how do we better support the moms? Because one of the best ways to support the babies is to support the moms first. So we're still in the midst of meeting as a task force. We haven't yet prepared a report of recommendations, but I can tell you the meetings are public. There have been a lot of really good discussion around how we could make better policy decisions and some better funding decisions. And the other piece that I think will be very helpful is having a better integration of some of our data sets. So we're very siloed in state government in terms of what we collect and how we use data. And this is one of those subjects where there's so much data available by many, many different parties. And we're all looking at it and using it for our own purposes. But we're not doing a good job of pulling it all together and trying to paint the bigger picture. So I think a lot of conversations need to be around non-traditional methods of reaching these children and the women. And that means not just talking about what we do in terms of offering treatment programs, but really talking about how do we engage these folks? How do we implement better prevention strategies? How do we ensure that they have continued long-term support? You do find a lot of times that the women become pregnant again a second time. And so you're seeing them cycling in and out of these systems. So I think collaboration, as the point's been made many, many times before, is really the secret sauce. And using all the funds that we're getting from the federal government, from settlement dollars, from state dollars, to support the programs that traditionally have not been well supported.
Great, thank you so much.
Dale?
Yeah. Yes.
Can I add something real quick in response to the Capitol's question? Perhaps the best program I have seen most effective over the years in Anne Arundel County was the creation of what's called a crisis response team, a collaborative effort through the police department, the health department, mental health agencies, an internationally, they created what has now been an internationally recognized effective team that can help deal with any sort of crisis, whether it be mental health, substance use disorder, or of course, they responded to the Capitol shootings. So that is probably the best thing I've seen and to come out of a collaborative effort through that council in 26 years.
Thank you. Dr. Moise, we're going to let you bring us home to the end of our hour here. And our question for you is, in your opinion, what can we do to elevate awareness about the substance use disorder process, treatment, the journey of recovery to remove a lot of the stigma? We've heard some good ideas, but in your opinion, what do you think?
Thank you, Dale. Appreciate it. I do agree. I think that's a foundational, fundamental question. You know, we don't have all the resources we need. We don't have all the money we need, you know, at the federal or state level to combat this problem, but we're getting there, and we're better resourced than we were a while back, not that long ago. But I think the question then is, how do we get people to take advantage of the resources that we do have currently and to partner with us at all levels, federal, state, community, to combat the disease? Because it's going to take all of us. And I think there's several factors, I think, that I want to be conscious of time, that limit and have restrained our ability to do that. One is social determinants, as has been mentioned already. Especially communities of color that are most impacted by this problem, as several people have already mentioned, and as we're experiencing in DC, have so many obstacles and so many challenges around health access in general, economic equity, racism. They're treated differently in the criminal justice system. All of those things have an impact. So people, one, are suspect of government and medicine and people that come into their communities and say, we have a solution for you. We want to help you. So we need to work on that, be more open, be more engaging, to not go to communities and say, we have a plan for you, but to go to the community and say, what are your issues? How can we help? What do you need? This is what we can offer. What do you think? What, you know, and really partner at the grassroots levels to help people, one, understand that we're sincere, and two, we're going to be there after the crisis is over, and we'll be following up. Number two, it's a stigma issue. Obviously, we've talked about that. And DC is really pushing at all levels through social media, through text outreach, through community. We also have a community crisis response team in multiple levels through the mayor's, you know, pronouncements and press conferences. You know, we need to get the word out there. Mental health, behavioral health is healthcare. It's really no different. It's just a different disease process or, you know, clinical presentation, and it's no different. And there's no shame, especially in communities of color, where people are very proud and don't ask for help because they've had to persevere and overcome for so long, that there's no shame in asking for help and taking advantage of opportunities out there. So I think if we do all those things, I think we will begin to see a difference in impacting this problem in the communities most affected.
Great. We really appreciate it. I want to thank all the members of our panel for their time and their insights. Again, we will do this Frontline report every year. Hopefully next year we will see some better outcomes than we have right now. I also want to thank all of you for celebrating my birthday with me today. So
Happy birthday.
thank you.
Happy birthday.
So without any further ado, we want to thank you, and we appreciate your time and
Thank you.
Thanks.
Let's keep it going. Thank you.
Thanks,
Thank you,
Dale.
everyone. Yep.
Thank you all.
Thank you.
Thank you.